Heart disease is a silent threat. It often shows no symptoms until it's advanced. This makes understanding heart disease crucial. Knowing the signs can save your life. It's not just about chest pain. Many symptoms can signal a problem. Chest pain is the most common sign of heart disease. It is often the first indication that something might be wrong with your heart. This pain can manifest in various ways, and understanding these differences is crucial for timely intervention. This pain can feel like pressure or tightness, almost as if an elephant is sitting on your chest. It can be a very alarming sensation, causing significant discomfort and anxiety. It might spread to your arms, neck, or jaw, creating a radiating pain that can be confusing and distressing. This spreading pain is a hallmark of heart-related issues and should never be ignored. Not all chest pain is created equal, however. The nature of the pain can vary greatly from person to person, and even from one episode to another in the same individual. Understanding these variations can help in identifying the seriousness of the situation. Sometimes it's sharp and stabbing, a sudden jolt that takes your breath away. This type of pain can be particularly frightening and may be mistaken for other conditions like a muscle spasm or indigestion. Other times, it's a dull ache, a persistent and nagging discomfort that lingers. This type of pain can be more insidious, slowly building over time and often being dismissed as something less serious. Any type of chest pain should be taken seriously. Don't ignore it. Even if the pain seems minor or comes and goes, it could be a sign of a more significant underlying issue. Your body is trying to tell you something important. Seek medical attention right away. Time is of the essence when it comes to heart disease. The sooner you get help, the better your chances of preventing serious damage to your heart. Prompt treatment can make a world of difference. Early intervention can save lives, reduce the severity of heart damage, and improve long-term outcomes. Don't wait until it's too late. Listen to your body and act quickly. Educating yourself about the symptoms of heart disease is also crucial. Knowing what to look for can help you recognize the signs early and seek help promptly. There are many resources available online and through healthcare providers to help you understand these symptoms better. Don't hesitate to discuss any concerns with your doctor. They can provide valuable insights and guidance on how to manage your heart health. Regular checkups and open communication with your healthcare provider are key to staying on top of your heart health. Making lifestyle changes can also play a significant role in preventing heart disease. Regular exercise, a balanced diet, and avoiding smoking can all contribute to a healthier heart. Small changes can lead to big improvements in your overall health. If you have been prescribed medication for heart disease, it's important to take it as directed. Medications can help manage symptoms and prevent further complications. Always follow your doctor's instructions and keep them informed about any side effects or concerns. Support from others can also be incredibly beneficial. Joining a support group for heart disease patients can provide emotional support, practical advice, and a sense of community. Sharing your experiences with others who understand what you're going through can be very comforting. Remember, heart disease is a serious condition, but with the right knowledge, timely intervention, and lifestyle changes, you can manage it effectively. Take charge of your heart health today and make the necessary changes to live a longer, healthier life. Shortness of breath is another common sign of heart trouble. It can be a frightening experience, leaving you gasping for air and feeling like you can't get enough oxygen. This symptom is often overlooked or mistaken for something less serious, but it can be a critical indicator of underlying heart issues. When your heart can't pump efficiently, you struggle to breathe. The heart's inability to circulate blood effectively means that your organs and tissues aren't getting the oxygen they need. This can lead to a buildup of fluid in the lungs, making it even harder to breathe. It's a vicious cycle that can quickly escalate if not addressed. This might happen during physical activity, or you might also feel breathless while resting. Imagine trying to catch your breath after a simple walk, or even while sitting quietly. The sensation can be overwhelming and debilitating, affecting your quality of life and making everyday tasks seem insurmountable. Shortness of breath can be scary. It signals your body is struggling. Your body is essentially sending out an SOS, alerting you that something is wrong. Ignoring these signals can lead to more severe complications, including heart attacks or strokes. It's crucial to pay attention to what your body is telling you. Don't dismiss it as just being out of shape. While it's easy to attribute breathlessness to lack of fitness, especially if you're not regularly active, it's important to consider other possibilities. Heart-related shortness of breath can affect anyone, regardless of their fitness level or age. Talk to your doctor to rule out any heart problems. A healthcare professional can perform tests to determine the cause of your symptoms and recommend appropriate treatment. Early diagnosis and intervention can make a significant difference in managing heart conditions and improving your overall health. Don't wait until it's too late. Take action at the first sign of trouble. Heart disease doesn't always present with classic symptoms. Sometimes the signs are less obvious. You might experience nausea or indigestion. Some people feel lightheaded or dizzy. Others notice pain in their upper back or abdomen. These atypical symptoms are often overlooked. People mistake them for other conditions. It's important to listen to your body. Any unusual symptoms warrant a conversation with your doctor. Women may experience heart disease differently than men. While men often report the classic symptom of chest pain, women can have a variety of other symptoms that are less recognized but equally serious. While chest pain is still common, women are more likely to have other symptoms, such as back pain, jaw pain, and shortness of breath. These symptoms can be subtle and may not immediately suggest a heart problem, making it crucial to pay attention to your body. Often, women might dismiss these symptoms as just stress or anxiety, and they might delay seeking medical attention. Stress and anxiety are common in daily life, and it's easy to overlook these signs as something more serious. However, recognizing the difference between everyday stress and potential heart disease symptoms can be life-saving. This delay can have serious consequences. The longer you wait to seek help, the more damage can occur to your heart. Early detection and treatment are key to improving outcomes and preventing severe complications. It's vital for women to be aware of these unique warning signs. Education and awareness can empower women to take control of their health. Knowing what to look for and when to seek help can make a significant difference. Regular checkups and conversations with your healthcare provider about your heart health are essential. Don't hesitate to discuss any unusual symptoms you may be experiencing, no matter how minor they may seem. Your doctor can help you understand your risk factors and develop a plan to keep your heart healthy. In addition to recognizing symptoms, adopting a heart-healthy lifestyle is crucial. Regular physical activity, a balanced diet, and managing stress can all contribute to better heart health. Small changes in your daily routine can have a big impact on your overall well-being. Support from friends, family, and community resources can also play a significant role. Joining support groups or attending seminars on heart health can provide valuable information and encouragement. Sharing experiences and learning from others can help you stay motivated and informed. Remember, taking care of your heart is a lifelong commitment. By staying informed, making healthy choices, and seeking medical advice when needed, you can protect your heart and enjoy a healthier, happier life. Empower yourself with knowledge and take proactive steps towards better heart health today. In some cases, heart disease progresses silently. There might be no noticeable symptoms at all. This silent progression makes regular checkups absolutely crucial. Routine screenings can detect heart disease early, which is especially important if you have risk factors like high blood pressure, high cholesterol, and diabetes. Heart disease is often associated with aging. While our risk does increase as we get older, heart disease can affect anyone at any age. Even young adults and children can develop heart problems. It's important to prioritize heart health at every age, which includes eating a healthy diet and exercising regularly. It's never too early to adopt heart-healthy habits. Early detection is crucial in the fight against heart disease. When caught early, treatment is more effective. Lifestyle changes and medication can slow the progression of the disease. Early detection also reduces the risk of complications. These complications include heart attacks and strokes. By identifying heart disease early, you're taking control of your health. The good news is that heart disease is largely preventable. You have the power to reduce your risk. By adopting a healthy lifestyle, you're strengthening your heart. Prevention starts with understanding your risk factors. Talk to your doctor about your family history. Get regular checkups to monitor your blood pressure and cholesterol levels. Making small changes to your lifestyle can have a big impact on your heart health. Start by incorporating more physical activity into your day. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Your diet also plays a crucial role. Choose fruits, vegetables, and whole grains over processed foods. Limit your intake of saturated and trans fats, cholesterol, and sodium. Regular checkups are like a tune-up for your heart. They allow your doctor to monitor your heart health and catch any problems early on. Don't wait until you experience symptoms to schedule an appointment. Prevention is always better than cure. Make regular checkups a non-negotiable part of your healthcare routine. Your heart will thank you for it.